Hi guys, welcome back to Tutor IMG's short medical series. We're going to be taking a look at a very important topic, and that's menopause. Now, when we are considering this particular topic, the most important aspect, of course, is the age at which menopause happens, and the average age is about 51 years. Women start to experience perimenopause about 8 to 10 years before the actual onset of the final menopause. And this time frame can be anywhere from 45 to 55 years of age in a woman, hence the average 51. Now, the main question about menopause is going to be about how do you diagnose it? How is it that you diagnose menopause? The answer to that is clinical assessment. All right. There is no actual chemical or lab test that we do to assess menopause. So choosing any other lab test or serum assessment is going to be wrong. Clinical assessment is the only correct answer here. And the way to do this is to ask a woman's history and establish that she has been in a state of menopause for 1 whole year. Now, there are special situations where the woman is not going through her menstrual cycle in a regular way. There could be women who have premature ovarian failure. There can be women who have been taking OCPs for a very long time for birth control purposes, and therefore they weren't really experiencing menstrual cycle as a regular woman does. Therefore, for them, menopause, of course, can be a whole different kind of situation. So in such scenarios where the case or the vignette describes a patient in this situation, what do you do then? You cannot obviously wait for her to be in menopause for 1 year because that's just not going to be the way it works for her. What do? You ask her to go off of the OCPs, right? For about 2 weeks. Sometimes you can extend it to 4 weeks to be very sure. And of course, in that scene, she's going to be using backup contraception. So she goes off the meds for 2 weeks, and then you measure serum FSH levels, right? So that's the only time in these special circumstances when the case on the boards describes these patients will you choose serum FSH as the way to establish menopause. And of course, the values would be higher than normal, right? So how do you treat menopause? Now, when we talk about treating menopause, we don't mean that we want to, reverse the process. What we mean is that menopause comes with a set of symptoms that women don't really fancy, especially the vasomotor symptoms, right? So the vasomotor symptoms that are present in women, hot flashes, they can disturb sleep, affect lifestyle, and be very, very upsetting. So women who need treatment for hot flashes, you usually prescribe them systemic MHT, which is menstrual hormonal treatment. This can be oral estrogens alone, or it can be a combined hormonal therapy, right? Of course, a combined hormonal therapy in this situation isn't not OCP because OCP has higher dosages of estrogen and progesterone. And what we need in this situation is a lower dose of the estrogen and progesterone, which is found in HRT. Now, coming to another very concerning symptom of menopause, and that is vulvovaginal, changes. And this vulvovaginal, especially vaginal atrophy, can be extremely painful for the female and cause a lot of dyspareunia. So to treat that, remember, if it's just the vaginal atrophy that she's coming in for, you do not prescribe systemic hormonal therapy for them. You will prescribe low dose, topical, which means, of course, vaginal estrogens. Okay, so it's going to be topical in this case. There are some patients in whom you would prefer the transdermal method versus the oral administration. And the patients whom you will prefer the transdermal patch in are women who have migraine headaches, right? Especially with aura. So these patients get the transdermal patch. They're not given the oral medication. There are some patients in whom you will not prescribe this hormonal therapy, right? And that is because these hormones do have a negative impact. So what are you going to watch for? You're going to watch for a patient who's got a greater age, right? Because patient age is extremely important. So when you're prescribing MHT, your candidate should be within 10 years of menopause onset. That's a very important consideration, and should be less than 60 years of age. Okay, and when these two parameters are fulfilled, you can prescribe the MHT for 5 years without any real risk. Other things to watch out for when you're choosing a candidate for MHT is the history of, you have to basically rule out cardiovascular disease and a personal history of breast cancer in a woman. Now, to assess risk for cardiovascular disease, we have, of course, a Framingham criteria, right? It's a risk calculator. And for breast cancer, there is also a breast cancer risk assessment tool that's available online, which takes into account the patient's age of menarche, the if ever the patient had any biopsies done on breast tissue for benign conditions, and any personal family history of breast cancer, the age, the ethnicity, right? So all of those will be considered, and her risk assessment for breast cancer will be taken into account. And if she has a personal history of cardiovascular disease or breast cancer that's very high, we will not choose her as a candidate for MHT. Another thing that helps you choose a patient for MHT is the severity of her symptoms. And severity, when we say of symptoms, we mean how bad is her vasomotor instability, right? The more severe her symptoms are, the more upset and disturbed her lifestyle is, the better candidate she is for MHT. Of course, ruling out all of these things still is important. When you are also prescribing or deciding to give somebody MHT, you have to consider contraindications to the use of oral MHT. So that will include hypertriglyceridemia, any kind of active gallbladder disease, right, or liver disease, and thrombophilias, right? These are going to be contraindications to oral estrogens. In these patients, you will prefer to give them a transdermal preparation. Now, when you are prescribing MHT for a patient, the final thing that you need to consider is follow-up. Women who are taking MHT usually experience a return of their menstrual cycle. The bleeding isn't as much as a regular cycle, but still it's there. And that's one of the main reasons why there's such non-compliance, right, with the treatment, because of the return of bleeding. Now, because the bleeding is present and it is postmenopausal, you need to advise the woman to keep a close eye on it. If this bleeding settles in 6 months, that is what we prefer. If it does not settle in 6 months, but rather increases, right, you need to then assess the patient for endometrial carcinoma, right? Because then it's going to be postmenopausal bleeding, and the way to assess her will be an endometrial biopsy. Remember, they usually give you a transvaginal ultrasound on the boards, but this is just this is not enough. It's not, the results given by a transvaginal ultrasound are not enough to rule out a cancerous condition. So don't choose that. Choose endometrial biopsy as the gold standard. The other follow-up you want to keep in mind is routine mammograms. Okay, that needs to be done for these women as well. So I hope this helps you on the boards. This video contains some of the highest yield points and the questions that you were asked on the boards about menopause. And if you want more detail, you can always subscribe to our course for Canadian licensing exams. And our website is listed along with this video. And if you want more videos like this, please continue to support our channel. Thank you very much.